Hi, my name is Tom Bartram. I'm an A&E consultant here at Macclesfield Hospital in East Cheshire. Look, the NHS is an amazing resource and you may not have had to use it yet, but it's always there for us in our times of need. In recent years, you may have heard about the increasing pressures on healthcare services and how we struggle, particularly in the winter months, to cope with the number of people that need us. We want to be able to give everyone the best care, but that can be difficult when there are so many patients needing our services at the same time. On average, we admit 30 patients a day to the 200 beds we have to treat patients. But what happens when these beds are full and the flow of patients just slows right down? If we can't discharge patients when they are medically well, or they don't leave hospital until late in the day, what happens to all those poorly patients who are waiting in A&E who really need a bed? So how do we fix it? There are no easy answers, but by working together we can make a difference. We are constantly improving the way we do things here at the hospital to make things better. But what can you do to help flow? Admission to hospital is not always the first, only or best option.
You may be referred to hospital by your own GP, and you may even be transported in an ambulance like this. That doesn't necessarily mean that you will be admitted to hospital. Following tests and investigations, if it is safe to do so, you will be discharged home.
That might be with an outpatient or clinic appointment, or even a referral back to your GP. That's helping flow.
If you are admitted, bring day clothes and the right footwear, as being out of bed can help recovery.
It's been really important to me to be able to get up out of bed, to start to feel so normal again, to get dressed in your own clothes and to be able to walk around when you've been used to being so fit and active.
So if you are admitted into hospital, remember to bring day clothes and footwear so that you can get up and keep moving. If you need other things to stay active too, such as glasses and hearing aids, bring that too. It really might mean that you could go home that little bit sooner. That's helping flow.
Please make sure all practical arrangements are in place for your discharge.
You might need someone to collect you and take you home or stay with you for a while when you do go home. You might need to ask us to organise transport, or you might need us to look into ongoing care for you. Making preparations will help us to get you home as soon as you are ready. That's helping flow.
Please prioritise collecting your loved one as soon as they are ready. Our aim is to discharge patients by 11 a.m.
Freeing up beds for patients that are acutely ill is one of our most important things we can do to make sure we have good flow. If you are collecting someone from hospital, it really does make a difference if you can pick up as soon as they are ready. If you can't be picked up straight away, we will probably bring you to our discharge lounge, an area in the hospital where patients can wait to be collected, or wait for transport, or discharging medication. Freeing up beds early in the day, that's helping flow.
Once you no longer need an acute hospital bed, please be prepared to receive any ongoing care in a different setting.
We have interim placements in various locations, such as Macclesfield, Congleton, Knutsford and Winslow.
That's where we can continue to work with you, build up your confidence, maximise your independence and hopefully get you straight back home.
If you decline a rehabilitation bed because it's not as close to home as you would like, this can cause a delay for your rehab needs, as well as for the patients in A&E that require a hospital bed. We ask you to consider them when it's time for discharge or transfer to another unit. This is helping flow.
This winter will certainly be another challenge for healthcare across the country. We want you to get the best care in the right place. Patients, carers and relatives can all help us keep hospital beds free for the sickest patients. By helping each other, we're helping flow.